Okay, very good afternoon to all. Hopefully we can start now. We have enough number. Can you hear me and can see the slide?
Yes, Prof.
Okay, so thank you very much. So time flies. Now is our last lecture on GIT. So we're going to cover second part of the lecture on the liver. Yeah. So we are lecture 2 on the liver. And this afternoon we're going to have our practical class as well as the case study. I will go through the case study for the second case study. I received most of the answer, yeah? So we're going to discuss, and probably we can have more discussion and Q&A, as mentioned here, to ensure that you clearly understand about the subject. And I'm happy probably I can deliver the lecture, at least you understand. That's very important. So with regard of liver, today we're going to cover more on the hepatic diseases. And when you look carefully there, before we start on the hepatic diseases, we can look in terms of the route of entry of the agent into the liver. So we look carefully later on, we can foresee that there's many route of entry that might lead to infection. Yeah, the agent could enter the organ, leading to formation of lesion, and perhaps is severe enough, could lead to disturbances on the function on the liver. I think I discussed on previous lecture what is the function of liver. Then you look in terms of the agents. So when we talk about agents, normally we always focus on two important things. One is the infectious, another one is non-infectious. And when you go for infectious, perhaps we might further divide it. It can be viruses, bacteria, parasite, fungals, and others. Yeah? So we have to look at broadly. So by understanding of what type of etiological agent, perhaps we might able to come up with more broader or wider differential diagnosis. Differential diagnosis is a disease. When you talk about diagnosis, we have differential diagnosis. Differential diagnosis is the naming of the disease. But we have also what we call it etiological diagnosis. Etiological diagnosis is an agent that can cause those diseases. Yeah, so this is important when knowing about the diagnosis. Yeah. Then we're talking about lesion. Of course, when you look carefully later on, common lesion also still inflammation, which is actually what is we have on the inflammation of the liver is hepatitis. Someone asking me, I think in the email, to differentiate between acute, chronic, and subacute lesion. I will discuss that later on during the practical class. Yeah? This is from Choi Wing Swin. Choi Wing Yun. Yeah? So we're going to discuss in the practical class later on during the what you call case study. Then look carefully there, we have also common diseases of the liver. Again, whether it's primary or secondary liver diseases. This was the clinical sign, or we can look at the manifestation of hepatic diseases as a result of failure of liver function. Many of us familiar with jaundice, hepatic, prehepatic, and posthepatic jaundice, cholestasis. Hepatic diseases also could lead to hepatic encephalopathy, and this partly because of failure of detoxification of certain toxin. Not forgetting effect also on the skin, practically leading to photosensitization, LSS, hydroperitoneum or edema, and hemorrhages. So what is important of this clinical manifestation is that when we conduct examination or physical examination of our client, with a dog or cat, so when we see that that animal have this type of sign, then we got to think of that animal might have liver function failure or disturbances, and at least you can foresee that there might be some changes in the liver, because diseases in the liver or clinical sign demonstrated related with the liver diseases, actually they can be a pre-hepatic, hepatic, and post-hepatic. Be careful on that, because it is pre-hepatic means you have to treat those are the pre-hepatic. It is post-hepatic. Post-hepatic, the common one is obstruction on the bile duct. Animal might have what you call it, stone in the gallbladder. So we have to do that carefully. I mean, they have to remove those of the stone because they are post-hepatic. And common one, of course, when they have hepatic, you have to get a very special, particular diet to ensure that the liver is not overloaded. So that's very important. First, your ability to see the clinical sign, or when you conduct necropsy, of course, the lesion. Then after you look at the clinical sign, you have to decide yourself, for example, which body system is involved. Yeah, that's very important. Is it only one body system, or is it multiple body system? And from there, you can start off, yes, for example, this is hepatic diseases. When you talk about hepatic diseases, is it pre-hepatic, post-hepatic, or hepatic? Then you start to think of about what is the agent cause those cellular damages or lesion will lead to dysfunction of the organ. Then only you can start to work out for the diagnosis. Remember, diagnosis based on the history, clinical sign, lesion, and identification or characterization of the agent. Then only what you call it, you can start to do the treatment. So even the treatment, you look carefully, the most common one, people might give a supportive treatment. Supportive treatment means that they are not specific. They are only to support the life of the animal based on the clinical manifestation. Okay, based on clinical manifestation. But that is only to allow animal to survive for a certain period of time, ensure that the body balance is equal, but they don't really solve the main problem. After give a supportive treatment, of course, the main problem to be solved, you give a specific treatment. Yes, specific treatment means the specific, whether it drugs or whatever, that can lead to eliminate the agents. Because the final, what I call it, treatment is very important, is to eliminate the agent. And when the agent there is no more there, and hopefully the damage is not severe enough, animal will recover. But remember, liver able to regenerate with some of the condition that we mentioned in the previous lecture. Yeah. So this is important. What I'm trying to say here is that when you are in the clinics, you are veterinarian examination animal, you see there is more on the clinical manifestation or the clinical sign, but you must have an ability, you must have a competency to ensure which body system actually affected. And can be single, can be multiple, and by doing know of those body system, you can think of about the agent. And we need an immediate treatment with the supportive treatment, but you must able also to do to collect right specimen, submitted to the laboratory for confirmatory diagnosis. So what is important on confirmatory diagnosis I mentioned earlier? This confirmatory diagnosis will help with regard of to eliminate the agent, and the animals or the patient will completely recover. The supportive treatment is just to sustain. For example, if the animal lost a lot of fluid, you give intravenous treatment that will maintain the condition of the animals. Okay. So regarding the entry, again, it can be direct or it can be systemic. At the direct one, you can see if there is a foreign body penetration straight away, sub-object. Yeah. It can be also invasion of the capsule from the infective factors, particularly in the case of larva migration. Yeah? So that is more from the external that really cause direct damage to the liver. And the second is more of through this route. You look carefully, they can be through vascular, through lymphatic, enable also through the bile duct. So in cases of hepatic artery, if animal in condition of bacteremia or septicemia, this agent, like bacteremia means presence of bacteria in the blood, septicemia, presence of the bacteria or even viruses, and the toxin in the blood. And this presence of agent and the toxin, if they will go to the hepatic entry, and most of the systemic infection could lead to disturbances in a hepatic function, meaning that they can lead to formation of lesion because they are more systemic. Most of the blood will go into the kidney and into the liver. Then we have also hepatic portal vein. If you look at the anatomy of this hepatic portal vein, they have direct communication from the GIT straight. Whatever blood from the GIT will first go into the liver through the hepatic portal vein. So meaning that if any organism which is pathogenic could enter or could successfully enter the physical or mechanical barrier of the intestine, so this organism will enter the hepatic portal vein and may cause infection in the liver. A newborn animal, particularly, of course, the presence of the umbilical vein might lead to mixed bacterial infection of the liver. Not forgetting the lymphatic channels, especially this lead to retrograde spread from the hepatic lymph node. Liver also have direct communication to the GIT, and GIT have direct communication to the environment. So there is always a risk of ascending bacterial infection, meaning that pathogenic bacteria that present in the lumen of the intestine may able to flow or go into the bile ducts because there's no barrier there. In intestine they have barrier of the enterocyte, but in bile duct they don't have. They just enter to the bile ducts, and then ascending infection might lead to infection in the liver. So in principle, we can foresee that liver is in the condition of high risk of infection, particularly systemic infection, for at least, in this case, from 5 different routes. So they are highly susceptible. This is what we discussed earlier in regard of the hepatic lobule or zone, yeah? And we had the portal tract. How you know the portal tract? Because they have 4 important structures there. One, in the portal tract, they have bile ducts, okay? Then they have the artery, which is thick wall of the blood vessel. Then they have the vein, and they have also the lymphatic. So this is the portal tract, okay? So when you look in terms of the etiology, I mentioned earlier, it can be a primary, it can be a secondary. Actually, primary is less compared with secondary because secondary, anything that lead to bacteremia, septicemia could lead to secondary infection. So if we talk about the primary, for example, in this case, when we talk agent or microorganism, we have of course infectious canine hepatitis due to the adenovirus. Adenovirus will cause lesion in the intestine, but more common, the target organ in the liver. Copper poisoning, which is non-infectious, where actually copper accumulated in the liver, and for long run, they lead to hepatic necrosis as well as lysis of RBC. Of course, there are quite a number of neoplastic or neoplasia, primary neoplasia in the liver that lead, of course, death to the animal. The secondary, this is an example of congestive heart failure. This is more of non-infectious what we call agent because of black flow of the blood from the portal vein. And I mentioned earlier, anything that lead to septicemia or bacteremia might lead to secondary infection of the liver. Any questions so far, class? Tak ada ya? Can you hear me?
Yes, Prof.
Yes, Prof.
Thank you.
No, Prof.
So internal lesion. So we discussed previously also on the lesion with regard on necrosis. They might have focal hepatic lesion, usually not shown any sign of hepatic dysfunction. You remember that if hepatitis, the lesion can be what I call it, focal, can be massive or diffuse, then can be occur in a zone 1, zone 2, and zone 3. There are 5 types of distribution of lesion in the liver. And they might have also diffuse hepatic lesion. And with a diffuse, of course, this might lead to much more severe impact and abnormalities function of the liver. These are some common diseases of the liver. I think we just put there example of viruses. I mentioned earlier, the example is so important there, and we don't touch so much the detail with regard of the disease itself. Although sometimes, most time, you look at your case study, you are asked with regard of the pathogenesis, you are asked about cause of death, you are asked of mechanism of lesion development of these viruses leading to diseases. So you ask, but I mentioned here in lectures, we don't go detail for each of diseases, but you are asked for pathogenesis and so on and so forth. So that's what we need to discuss during our practicals. We don't discuss in details during our class because you will be asked. But normally the mechanism is almost about the same for different type of viruses. Okay, so you are giving you a fundamental and concept and how actually disease develop, mean that pathogenesis of the disease. Yeah, how actually lesion develop, mechanism of lesion development. How actually we call the lesion, you call it there's no morphological diagnosis of the infected organ. Okay. So this infection is example of infectious canine hepatitis. You look carefully at the liver is swollen and they are reddened of a canine is a dog. And you might be able to appreciate there quite certain degree of hemorrhages, yeah? Hemorrhage, which is generally occur throughout the hepatic parenchyma. Yeah? Of course, looking at that, we must see it is actually a hepatitis, isn't it? Reddening, maybe like painful, organ enlarged, swollen. Yeah? There is criteria of inflammation. And you conduct histology examination. We have this slide for your practical class. You can first see that this is a normal hepatocyte, my arrow, normal hepatocyte. You can see some of the nucleus there. Then this is the RBC. Yeah, the RBC, all within hepatic parenchyma. So you can see RBC there. Sometimes in the liver, you might have some difficulty to differentiate whether this is hemorrhage or congestion. One way to differentiate that, of course, you look into it carefully. If it is a congestion, the blood presentation is very well organized. They were very organized because they are controlled and they are located only at the sinusoid. But when it hemorrhage, please remember hemorrhage is due to the rupture of blood vessel. You can foresee that the organization of blood, they will splash over, like in this case. So in this case, you don't really appreciate the way that where the blood is not well organized, very nice, okay, good conditions and so on, but they are now splash each other. And sometimes people are angry, you know. So that is actually hemorrhage. Like in this case, histologically, I think the liver is undergone those hemorrhages. But more interesting here, when you look at the nucleus, So you can see those of basophilic appearance. Yeah? And then the nucleolide owl is being pushed to the side. So this is actually what we call it as intranuclear inclusion body. Intranuclear inclusion body. And the color is basophilic. So usually the intranuclear inclusion body can be presented in two different types of color. One is basophilic, one is eosinophilic. And it was believed that, based on evidence, electron microscopy, the basophilic one comprise numerous of virus particles, while those eosinophilic one is more of past infection, and what left there is only the protein. There's no more virus there for the eosinophilics. Yeah. So of course, in this case, you can see intranucleation body as a result of adenovirus infection in case of infectious canine hepatitis. Okay. This is an example also. The one canine is a dog, isn't it? But in this case, we have inclusion body hepatitis. And this is in chicken. In chicken, inclusion body hepatitis. Again, they are caused by adenovirus, called adenovirus. I think this lesion, when you look in terms of the gross appearance, they are so nice. Nice meaning that very typical lesion of hepatitis. Yeah. Actually, this liver is from the first reported case of inclusion body hepatitis in the country. The first one reported. Yeah, reported means published and reported. Yeah, this is the first one. And you can foresee that what you can see, in principle, the liver enlarged. Yeah, they are enlarged there. And when you look at the side also, the side of the liver, they are normally sharp, no, but in this case they are blunt. You know, they're blunt appearance. Blunt means why they're blunt? Because they involve the enlargement of the organ, swelling of the organ. So swelling is one associated with inflammation. And then we can foresee also some petechial with very big ecchymotic hemorrhage distributed throughout the hepatic parenchyma. You can see here. But in addition to that, you can see also the liver enlarged and they acquired yellowish. This yellowish can be two possibilities: jaundice, or another one is it is fatty liver. So we be careful and looking that, because the tendency also is yellowish because the color. It is associated with jaundice. Another one is because hepatic damages, but another one also is associated with fat. We give a what I call it yellow color. Beautiful hepatic or hepatitis in the liver, and in this case, a case of infectious inclusion body hepatitis due to the full adenovirus infection. Yeah. And more interestingly, when it is a very typical, I mentioned to you, the first case, this liver is from the first case of inclusion body hepatitis reported in the country. So when you look further, this is so nice. I really appreciate this, so nice, what I call it, hepatic parenchyma with the lesion. What you see here, of course, some area there you can see is RBC. Previous one, we have liver or dog, so RBC non-nucleus. But in chicken, the RBC with nucleus. So there is a RBC there. Probably in this case, in terms of hemorrhage, maybe you got some difficulty to appreciate. Only when you go to much larger area, then you might appreciate more the appearance of hemorrhage. Okay, in this case, you can see the RBC are around this area with some degree of hemorrhage, but sometimes difficult to appreciate. And when you look at the side here, you got a hepatocyte there. Okay, there's some mild changes of the nucleus. This is more normal, hepatocyte. With the cytoplasm or hepatocyte, you can see the nucleus. Quite number of few normal cells there. But otherwise, what you see actually is those enlarged nucleus with basophilic staining. Like in this case, basophilic. This one also quite basophilic. This one mixed between basophilic and eosinophilic. And this one is more of eosinophilics. So they have what we call it very typical intranuclear inclusion body. Typical intranuclear inclusion body. In this case, you have two different color, basophilic and eosinophilic. As mentioned earlier, the basophilic one is where the virus is still there, but the eosinophilic one is actually only the, what we call it, protein. The virus no more there. In normal situation, when there's an infection, the virus might be in the organ just within 14 days. Then after that, they'll be eliminated by the body defense mechanism, particularly the hormonal immune response as well as cell-mediated immune response. Meaning that when there's infection, if the animal can survive for a period about 14 days, 1 week or 14 days, the virus actually will be eliminated from the body, some completely, some not completely. And in cases of adenovirus, might not be completely, because sometimes they might get latent infection. In cases of herpes virus infection, they are not completely removed also because of latent infection. The virus will hide in the nervous tissue. But in principle, to all many viruses, by this period of time, they will be eliminated from the body as long as the body response will produce enough antibody as well as cell-mediated immunity. That's why the animal will recover. The only impact is that if the damages are severe, they might interfere with the normal function of the liver, and they might lead to, you remember, in terms of healing process, the cell might be replaced by fibrous tissue. When the rate of regeneration of new cell or hepatocyte is slower than what we call it, the cell damage caused by the agent. In this case, it's the virus. Question, class? Any question? You okay?
Okay, Prof.
Okay, thank you. So this is also very nice there. You can see there. Again, it's just a matter of further magnification. You see basophilic there? Out there is your nucleus that you push outside. Then you can see some also is eosinophilic. So they're mixed there. So it's very nice, very clear, a typical intranuclear inclusion body. And in this case, they are typical for full adenovirus infection in chicken. So they're almost pathognomonics. Okay. So this is the example, less clearly than before. Of course, this is not from chicken. This is more from pet bird. Yeah? You see that it can show the presence of what I call it, those or inclusion body. Yeah? And those vacuole, actually some of vacuole there is more fat tissue in the organ. But inclusion body also can be seen when talk about canine distemper, for example. And this is also quite diagnostic, almost pathognomic also. When suspect of canine distemper, an animal die of this canine distemper, and if we are lucky enough, the time of sampling is correct, you might able to see the presence of inclusion body. Like in this case, the inclusion body is eosinophilics. You can see the nucleus there. They are present in the cytoplasm. So canine distemper could lead to presence of intracytoplasmic inclusion body in the bile ducts. So this in bile ducts. Okay. So interesting also. Then episodic hemorrhagic diseases are this more as a result of a herpes virus. Okay, you can see those of the ecchymotic hemorrhages, and this is from the deer. Again, this deer also is the slide I show you is our cases at UPM. Yeah? This is a deer also imported deer, and after some time they got infection with these episodic hemorrhagic diseases suspected caused by herpes virus. If these are bacteria usually cause what you call it bacteremia or septicemia. It's systemic infection. Virus just now, so they can cause viremia, But some of them, the target organ is really the liver. For example, tuberculosis. So tuberculosis, you can find the lesion anywhere. Remember, we have tuberculosis lesion in the intestine, very common in the lung. But of course, it can cause also lesion in the liver. Myelodisis, of course, they can cause anywhere also, but they can cause also lesion in the liver. Similarly, pasteurellosis, chronic bacterium, and others, salmonellosis, leptospirosis, and listeriosis. Mean that this one is much more broader because all those the agent might lead to bacteremia and septicemia. This is an example of tuberculosis, and sometimes may be difficult to differentiate with other pyogenic bacteria. What I mean by pyogenic bacteria is that bacteria can cause or produce pus to their infection. When the infection, they can cause or produce pus. So a pyogenic bacteria, like in cases mycobacterium, is pyogenic bacteria. So we can foresee those are the lesion, those multiple abscesses in the liver. And I mentioned earlier, I have case also, that's example that we have in the intestine, tuberculosis. The appearance of the pus in the lung is so severe like this as well. So they are systemic. Same thing also myelodisis. Again, this is our case also myelodisis. This is a myelodisis case in orangutan. In orangutan, submitted to us, and you can foresee that those are caseous material that present in the because in the abscess, because abscess got capsule, and as well as you can see those of the severe throughout the liver. I mean the animals or this orangutan die off due to the septicemia. Okay, they got a liver infection, and this is a case of myelodisis. And this is how we can foresee. When you see the abscess, what is abscess actually? Abscess is dead neutrophils. Yeah, the abscess is dead neutrophils. Why there's a dead neutrophil there? Because this bacterial infection, when you have bacterial infection, the main response of the bacterial infection is what we call it, a response is a neutrophil come first. So inflammatory cell, their role is to fight and kill the organism, pathogenic organism. But if they fail, that's why this neutrophil die off and they form an abscess. Yeah? This is how we can link those of the dead neutrophil in the. This is the live one. This is the neutrophil, can the lobule there, but otherwise all is being fragmented, and that's how we can see grossly as an abscess. And this is very important also in chicken. You can see fall cholera. In fall cholera, it's very typical. You can see pinpoint necrosis of the liver. Recently, I have a case of suspected fall cholera, but confirmed positive with molecular detection by PCR. Very typical lesion, very nice. We can see those type of necrosis and so on and so forth. But unfortunately, when do culture, we fail to culture the organism. So big surprise. So the question is that why they fail, and then we conduct a disease investigation and ask the submitter. First question is that whether the animal been treated with antibiotics or not. Most of the time in the field, when there are an outbreak of bacterial diseases, they will use antibiotic for the treatment. Yes, for that case particularly, animal has been treated with antibiotics, and when you conduct the culture of the bacteria, even with some of the quite typical lesion, fail to isolate the bacteria. Partly, the antibiotic is so effective. So it can raise an issue when antibiotic is effective, meaning that we need to use antibiotic to treat bacterial infection. It's allowed actually, that was allowed with the proper what I call it approach. What is not allowed is to add antibiotic in the feed. Yeah? Certain antibiotic is been banned not to use in the feed because they might lead to antimicrobial resistance. But the use of allowed antibiotic, allowed means some is not allowed, allowed antibiotic for treatment is right. But the important thing is that to ensure there will be right time of residual period. Pending antibiotic, residual period can be 1 week, 2 weeks, or maybe more than that. So of course, for those bird, but unfortunately that history that I mentioned to you is from breeder. So it's not too bad because we didn't slaughter breeder bird. But it is from broiler, of course, when they pump in with the antibiotic, in treatment with antibiotics, the meat or even maybe the eggs is not fit for human consumption because we might have later on what we call it antimicrobial resistance. That's why they said we should produce or reduce the use of antibiotics. And to do that, there's many approach. One of them, of course, we have to establish what we call it vaccine against bacterial diseases. So when we have vaccine against bacterial diseases, so the chances, risk of bacterial infection is less, and the chances of treating bird with what we call antibiotic as a result of disease outbreak is much less also. So that will help in terms of development of antimicrobial resistance. The same thing also for cholera. You can see those of the pinpoint necrosis, very typical. But sometimes this case also, we can have differential diagnosis for other bacterial diseases. The most common one is Salmonella. Yeah? They can have producers about the same appearance. I mean, they got a lot of differential diagnosis with regard of what I call it, the lesion. But I mentioned earlier, in the field, common approach is to give a treatment with antibiotics. But people not concerned, abuse of antibiotic could lead to increased chances of antimicrobial resistance. And when they cause that, the risk of patient, where when patient down with the infection letter in their life, there will be very limited choice of antibiotic to treat when they have a bacterial infection. So one of the issue, even world issue, as you are aware now, is antimicrobial resistant, yeah? AMR. So I think you have to be careful also and try to understand also, do some reading on what this is antimicrobial resistant. They are very important for us and mainly important to animal industry as well as human population. This is Corynebacterium, you can see so, those of the lesion, okay. And this is Salmonella, you can see those of Chisi, what you call it, necrosis, abscesses. When you talk abscess, this is a capsule there, again the liver. And I can show you, this is a case of Salmonella, yeah, but same thing also, got pinpoint there. So another one, the third one is common one is parasite. I think one is fasciola or fasciolosis, Trypanosomum, Capillaria, Echinococcus, and Ascaris. This all can cause lesion in the liver. This fasciolosis, the entry actually is from the capsule, yeah, live migration to the capsule. And in this case, you can see a lot of, actually this one is not fibrin, yeah? There's something different between fibrin and fibrous tissue. This more of fibrous tissue because damage and leading to adhesion later. A fibrin, they are more jelly appearance. Jelly means easily removed from the surface of the liver. And if the fibrin, please remember, that one actually is due to the escape of fibrin from the blood vessel covering the capsular surface of the liver. So we call it as fibrinous hepatitis. But in this case, actually I do damage of the capsule. And when the damage, actually what happens is that the area being replaced by fibrous tissue. Fibrous tissue, the origin is from the fibroblasts. Fibroblasts. So that leads to formation of fibrous tissue. So fibrinous material and fibrous tissue is a different thing. Be careful on that. This is how actually when you look, the real case, Our real case. So from our lab, we're in postmortem room. For our postmortem room, you can see that the river flukes, they are present in the bile ducts. Of course, just based looking at this, the bile duct is thickened. How we call it bile duct hyperplasia. In this case, of course, more towards proliferation of bile duct in response to the presence of liver fluke on the bile ducts. And they are also present in the gallbladder. Those L ducts, what we call it, flukes. But in this case, the fluke be authorized. But in this case, they are quite fresh, isn't it? You can see very clear L duct liver flukes. And we're very fortunate when you do histology, we really include those are the liver fluke. This is a liver fluke with a spike there. So probably this spike that lead to irritation to the mucosa. And you can see that there's quite a number of bile duct proliferation. So in this case, more proliferation. You can see some is, we call it hyperplasia. Hyperplasia is increased in size, isn't it? But proliferation is what I call it. We have here is more towards proliferation, which is hyperplasia. The atrophy and hypertrophy. I'm sorry, I try to differentiate between atrophy is smalling size of the cell. Hypertrophy, the cell get increased in size, but not the number. Hyperplasia is proliferation of the cell, like in this case. Yeah, meaning that the cell will undergo proliferation, increase a number of cells. But all, whether it is hypertrophy or hyperplasia, will lead to increased number of cells. And usually, it is severe enough, we demonstrated with what we call the enlargement of the organ. So in this case, so nice, a real case, and you can see the fluke grossly, as well as you can see what we call it, the liver fluke inside there. Then we have a toxin, non-infectious. The most common one, of course, is copper poisoning and bacteria decumbens toxicity. So this copper poisoning and bacterial is sometimes about the same, but we have those two very important. Then, of course, aflatoxin also as a result of the fungal. And this toxin also could be as a result of our drug use, particularly pentobarbital, carbon tetrachloride, and acetyl salicylic acid. So this all can lead to toxic to the liver. When we suspect toxicity, particularly chronic toxicity, again, like in case of toxicosis, you can see that there's a proliferation of the bile ducts, like in this case. People believe that the bile duct is proliferated partly because the organ response try to remove the toxin as much as possible. That lead to those of the proliferation of the bile ducts. And this is a case of chronic copper poisoning. Remember that chronic copper poisoning, normally animal might consume, whether it's acute or chronic, but most of the time copper poisoning is a chronic. And this is our real case. I mean, it's not from anywhere. It's our real case of chronic copper poisoning, where actually in our situation, sheep is more susceptible to chronic copper poisoning. And the most common one, if the animal feed on the pumpkin cake based diet without any treatment. I mean that is a raw pumpkin cake, no edited treatment, and so on and so forth. Usually the content of copper in this pumpkin cake is quite high, ranging from even 25 or even 30 or 50 parts per million. They're high. So with time, animal will consume this copper. The copper will absorb from the GIT. Then they go to the, what I call it, to the blood vessel. And with time, they will accumulate in the liver. So when the concentration of copper in the liver exceeding the limit, that lead to necrosis of the liver and escape of the copper, free copper in the blood circulation. So during that time, what we expect to see, there will be necrosis of the liver, but at the same time also the presence of high content of free copper in the blood vessel, as well as they might have also in the kidney, that lead to lysis of RBC. Yeah, lysis RBC. So depending on which comes first, when there's a stage of hepatic necrosis, not a level of lysis RBC, animal also might have a jaundice. Yeah? Jaundice because there's a damage or failure of liver function. But when there is an excessive escape of the free copper into the blood circulation, there will also lysis or RBC, leading to hemolytic crisis. When they have this hemolytic crisis, again, excessive hemoglobin, animal also will have a jaundice. Of course, the jaundice might be more severe. This will also, we might expect to see also what you call it when the hemolytic crisis, the blood will change in color, the urine also become darker, it's stained with hemoglobin. So there's two episodes there. I mean, one is just hepatic necrosis. I am telling this is how the pathogenesis, how actually what you call it jaundice develop as a result of copper poisoning, how actually hepatic necrosis occur as a result of copper poisoning. So the mechanism of jaundice in cases of what you call it copper poisoning, the mechanism of hepatic necrosis in cases of copper poisoning, the mechanism of hemolytic crisis and hemoglobinuria, present hemoglobin in the blood as a result of chronic copper poisoning. That meaning that the mechanism on the development of a lesion. But of course, the pathogenesis will continue. When they have hemolytic crisis, for example, what happened? Again, it might be the same when the hemolytic crisis, disturbances in circulatory blood circulation, low venous return, low cardiac output, failure of the vital organs, and so on and so forth. That is the pathogenesis until death. But the development of jaundice, hepatic necrosis, hemoglobinuria, that one, the mechanism, how those lesion or condition develop. Ada soalan? Any question, class? Tak ada ya? Are you okay?
Yes, Prof. All okay.
You are waiting for your lunch. You can have your lunch so while letting lecture, no problem, isn't it? I cannot take lunch when giving lecture. But you can take your lunch while attending the lecture, isn't it? Okay, we proceed. And these are the lesions in cases of chronic copper poisoning. You see the very severe jaundice just now. I mentioned earlier how this jaundice develop. Can be hepatic, can be pre-hepatic, and even can post-hepatic also. Because you can foresee those of the gallbladder and the liver, yeah, and the more generalized there. And this again, when you look at different view, same case also of chronic copper poisoning. And you can see those of the jaundice. Just for information, this is actually my research animals. When I was started my work, we started with the ruminants. We had study on copper toxicity, same as all the lesion that we found in the deer. They also deer actually used for copper toxicity, but they down with what we call it Malayan cattle fever. And we buy deer also, but suddenly the deer down with tuberculosis. So all those material actually is all research material in addition to some of the postmortem case that we received at postmortem room. So this also research material working on the copper toxicity. Okay. But now I'm working more on the avian rather than in ruminants. Okay. And this also you can see, what I call just now is hemoglobinuric urine. But of course, in this case, a blood glomeruli, because you can see hemoglobin actually, in this case, in gallbladder, very severe. Yeah, very severe. And you can see in terms of the blood, so when animals just have hepatic necrosis, animal have only jaundice, the blood is yellowish compared with the normal one. But when the excessive amount of copper in the liver, that will lead escape of free copper in the blood vessel, that lead to what I call it hemolytic crisis of the blood, You got hemolytic crisis. And now you can see the serum is become dark red, yeah, because of hemolytic. So based on this also, you can differentiate the stages of the infection. So in this case, more hepatic, and this darkened one, they involve both pre-hepatic and hepatics. Of course, this case also, just yellowish, can be a result of hepatic and post-hepatic. I think we know about hepatic, we know about pre-hepatic, post-hepatic, and hepatic jaundice. Okay, that can occur in copper toxicity, depend on the stages. Then we have nutritional or metabolic disturbances, like in cases of pregnancy toxemia, exothermia, or ketosis. And this is how the liver look like. They have more of fatty liver, very yellowish. When you cut, of course, you feel that oil on the knife. Histologically, you can see those of the white unstained, what I call a hepatocyte. This partly because this area been occupied with fat. So when we process the tissue, we're using ethanols, and as well as using, they will be washed out. That's why you can see those process dehydration remove away the fat. So you can just see whole there. So you want to see the fat, we need to do a frozen liver tissue, yeah, frozen, not using the normal process, which NNE, but you need to have a frozen sectioning. And this fatty liver, you can see how bit oily of this liver. Yeah, again, it's our case there. And this is how we can see those of the fat that been accumulated in the hepatocyte. Fatty liver can kill the animals. Yeah? I think we discussed last time during our lecture on Monday. Then we have neoplasia, can be hepatocellular adenoma or carcinoma, and involved with the bile duct, which is cholangitis adenoma, carcinoma. Of course, the systemic one, we have lymphocytoma. This malignant melanoma, you can see melanoma of those are the black color, but not all the time. Case of melanoma will show those of the black pigment, not all the time, yeah, but most of the time, yes. And this is lymphocytoma. You can see of those of the neoplastic tissue all over the liver. And this is a lymphocytosis. Okay, you can see those in chicken also is a tumor cell in the liver. And other than that, you expect to see the liver with circulatory disturbances, in cases congestive heart failure, because the blood flow, and sometimes functional disease in certain breed of sheep and dogs. This hepatic congestion, they are mainly focused on the central vein, and you can foresee that those central vein is congested. Yeah? This is a portal tract there, this is a pill. And that lead to, can be hepatic necrosis, because that those island of normal cell, normal hepatocyte will regenerate, but they are surrounded by fibrous tissue. I mentioned earlier, because liver are able to regenerate, those cells that regenerate will regenerate, but if the rate of regeneration is slower than rate of necrosis, so they will expect to see. You can see an island of normal cell with the regenerating, but at the time, you can see a lot of fibrous tissue surrounding it. Okay. And this is, of course, the most severe one. We call it hepatic cirrhosis. Yeah, you see a lot of those regenerating hepatocyte with numerous severe infiltration of the fibroblasts. I think we continue in the afternoon before practical on the manifestation of hepatic diseases. And then, or maybe after the practical, we cover this. I think the time now is 1 o'clock. So we should stop here. We can have our lunch. Then we can come back. We have more time in the afternoon to discuss the practicals, as well as to continue part on the lecture in liver, on the manifestation of hepatic diseases or failure of liver function. We discussed that on the 5 main important items. With that, any question, class?
No
Any question?
question, Prof.
Okay, ya. Kalau tak ada, kita we adjourn our meeting, our class. Then after that, we come back at 2 o'clock. Okay. So thank you very much. Yeah, and enjoy your lunch. Okay.
Thank
Enjoy
you,
your lunch.
Prof.